Now, studies show giving people access to health care increases their chances of not dying. Isn't that crazy? That whole concept that if people have health care, then they can do some things and they just might not die. Yeah, that's crazy. Expanding Medicaid to all states is not a wild idea. It is a good idea that could and has saved many lives. As Congress prepares to kick millions of people off of Medicaid, which includes support from both Democrats and Republicans. Yes, you heard it here on Unbossed because we let you know what both of those parties are doing. Let's put up this headline. Studies show Medicaid expansion rejected by GOP increased cancer survival in other states. In other words, other states got that money that those selfish GOP governors didn't want. And they run for office. I mean, how can you call yourself a public servant, but you don't do all that you can with public policy to help ameliorate suffering? It doesn't add up for me. Landmark research was published this week, which found using nationwide cancer registry data, our study shows a survival benefit of Medicaid expansion under the Affordable Care Act for young adult patients with cancer, particularly among racial and ethnic minority groups and patients at risk for poor prognosis. The impact of these data is enormous for young adults who often come to diagnoses late due to the lack of cancer screening guidelines in their age groups. And thanks, Aflac, for that, laying that out for us. And researchers went on to point out the following. Access to medical care for early detection and cancer treatment is afforded by Medicaid expansion programs and is critical to our advancement of care in the young population who often fall between the gaps in our healthcare system. That's coming from Dr. Sharon. Thank you for that, Dr. Sharon. 38 states have expanded their Medicaid programs. 11 states have declined. Let's put up these states of shame, shall we? Alabama, no surprise. Florida, Georgia, Kansas, Mississippi, North Carolina, South Carolina, Tennessee, Texas, Wisconsin, Wyoming. We see a pattern there, Adrienne, a lot of southern states. No surprise. Research comes as federal lawmakers are working to pass a nearly $1.7 trillion, 4,155-page omnibus government funding package. If the bill passes and is signed into law by President Joe Biden, as is expected in the days ahead, millions of people, and underline it, underscore, bold it, put an exclamation point by it, and a message in a bottle on a train, could lose their Medicaid coverage as early as April. So Adrienne, I'm not trying to be sarcastic here. I don't understand how some of these folks can call themselves public servants.
Absolutely. The fact is that they're not serving the public, they're only serving themselves. And they are also serving this whole sense of status quo and maintaining this class divide and ensuring that the people who don't have access to the resources to be able to prevent these diseases and infections and things that they may end up developing, that they continue to stay as helpless and vulnerable as they are, despite the fact that they pay taxes, damn sure paying more taxes than Donald Trump. Yet still, at the end of the day, they can't get those who represent them to come together and to provide them with the resources that they should have as not only citizens, but also members of the human race. It's really disheartening, especially when we look at how other nations are and the fact that we are not providing medical care for individuals when it's not necessarily tied to our employment status or in this little box that really holds us all down, especially when we're seeing trillions of dollars being spent on war.
Yeah, say that again, Adrienne. We covered this war, amp up to war on the Unbossed for several weeks, and we really hit it hard this week because they gave this president $45 billion more than what he asked for. It continues to grow. This military-industrial complex for war making doesn't help anybody. We need to spend as much money on the domestic side of the ledger as we do on the other side. It's really painful.